I have a couple of additional questions I want to add to the conversation here. Uh, Next one is, I think this was part of your background, Mr. Barola. As of 2020, 39% of all undocumented students pursuing graduate degrees have an undergraduate degree in STEM fields, and thousands of DACA recipients work in healthcare roles as teachers and in food and agricultural industries. Now, DACA recipients, we know, pay billions of dollars annually in state and local taxes. And like international students, found businesses at higher rates than their native born counterparts. So these are young people who are creating jobs and revitalizing communities in the process. Indeed, DACA recipients like Dr. Larios have played a critical role as essential workers during the pandemic and in our ongoing economic recovery. That's why I introduced the Citizenship for Essential Workers Act as my first bill in Congress last year to provide essential workers like Dr. Larios who keep us healthy, who keep us fed, who keep us safe during the pandemic with a pathway to citizenship. Now, Dr. Larios, as a physician, do you worry about the impact on patients' medical care if you and other DACA recipients who are working in healthcare lost your ability to live and work legally in the United States?
Yes, absolutely. This is something that I worry about. The AMC, so the Association of American Medical Colleges, published a report in June of 2020 noting that there's a projected shortage of up to 124,000 physicians in the next 12 years. Together with our ongoing pandemic, every member of the healthcare community counts. We need everyone, every doctor, every nurse, every physician assistant, and so on to continue ensuring that our population in the US is taken care for properly. With this said, there are nearly, as was mentioned earlier, 30,000 DACA recipients in healthcare and about 200 medical students and residents who, again, have DACA and would be able to contribute to this, to ensuring that the shortage is a little bit lessened by having more members participate actively and contribute. The AMC has also noted that in their lifetime, if you look at those nearly 200 medical students and residents that have DACA, they will touch the lives of 1.7 to 5.1 million patients. Certainly, this is not a trivial number, and knowing that we have an America that has enough doctors that can care for them is something that I think we can all be on board. And it highlights that everyone matters, and deportation, especially in a time of need, would not make sense. So definitely something I worry about from a numbers perspective. And from the other perspective is from a cultural perspective. We want to show that our healthcare workforce and really any workforce represents the people that we're serving, that it is diverse, that it comes from individuals from all aspects of our America. And I think DACA helps do that as well.
Absolutely. Particularly cultural competency in medical care is important for ensuring quality of care.
Correct.
Now, we've also heard today how training and developing and retaining immigrant students here in the United States is imperative to preserving our global competitive edge in technology and innovation and continuing to help our economy recover. However, in order to obtain a visa to come to the United States, international students must typically demonstrate that they are not intending to stay in the United States following graduation. That seems short-sighted for our country if we want to actually compete for global talent. Students who study here and wish to remain must navigate outdated and restrictive immigration policies, including a highly competitive temporary visa lottery and a years or decades-long backlog for employment-based visas. Mr. Barola, I know in your previous answer we touched on this, so I'm asking you to maybe expand and explain why it is difficult for an international student graduate to simply stay and work in the United States after completing their studies, and also how not just how it impacts the students themselves, but how it impacts the universities and colleges as institutions.
Thank you, Chairman. It's interesting. The U.S. is really the only country that has this immigration law which does not allow students to stay after they complete their studies. Other countries welcome them to their universities and then continue to welcome them to work and contribute to their economies. We do not do that. As I mentioned, after about 60 days after graduation, students will need to either depart the country, get an H-1B visa or a green card, or they could also use optional practical training, which is one option where they stay as an international student and contribute by an academic process of learning a particular field for a short period of time. But it's still not a pathway to a work permit. And this makes it challenging for our universities to compete with foreign universities that have that option. When a student is looking at where to study, they're looking at how quickly can they get that student visa, how expeditiously can that visa be obtained, and also can they stay and work in the country after they finish their studies.
Thank you very much. Senator Booker for a second round.